gather all the equipment you require to perform the test. You will need a pair of gloves, an alcohol wipe, some cotton gauze, a pipette, a lancet, and ensure this is set to the deepest setting by twisting the head toward the deepest line, and finally a test strip. Before the testing begins, explain the procedure clearly to the client and ensure you have obtained their consent. It's important to check the client's hands are clean, warm and relaxed. If they are too cold, it might be difficult to get an adequate sample of blood. To warm the hands, ask the client to wash under warm water or rub them together. Ask the client which finger they would prefer the sample to be taken from. Ideally, this should be the middle finger of their non-dominant hand. Clean it with an alcohol wipe to remove any possible fats, grease or soap residue. Then dry the finger thoroughly with cotton gauze, as alcohol could affect the outcome of the test. Switch the machine on and insert the test strip. When lanceting the finger, a single-use retractable lancet is recommended to produce the required sample of blood. A standard diabetes lancet is not recommended for this test. Ask the patient to place their hand on the table, holding the finger from the base. Then push the lancet firmly on the finger to puncture the skin. Ideally, this should be at the side of the fingertip, about 5 mm from the edge of the nail bed, as there are less nerve endings here and will be less painful for the client. Dispose of the used lancet in a suitable sharps bin. Always remember to wipe away the first drop of blood, as this may contain tissue fluid. Apply pressure along the finger, but don't press or squeeze anywhere near the puncture site, as this may affect the sample. Without squeezing the pipette, simply touch the tip to the drop of blood and it will automatically fill up to the black line. Wipe off any excess blood and provide the client with some gauze. Ask them to apply pressure to the wound until the bleeding stops. Apply the blood sample to the test strip and then dispose of the pipette in a suitable sharps container. The analyzer will start testing and the results will be displayed within 2 minutes. Navigate through the results, ensuring you've recorded all the required measurements. Remember to dispose of the used test strip in the sharps bin. Finally, share the results with the client and record them in their notes.